Welcome to another production by the Millennial Mechanical Therapist. Your hosts, Dr. Joseph Gravino and Dr. Clay Case, are two physical therapists trying to treat health issues mechanically. Listen further for patient cases, guest videos, advantages and disadvantages of the way they practice, and much more. Thanks for tuning in today. Check us out on YouTube, Facebook, and at our website. We hope that you learn a lot from watching this video and you come back for more. Hey everyone, I'm the Millennial Mechanical Therapist, and today I'm going to talk about why I treat the way that I do and why I like using MDT more than some of the other methods that physical therapy has to offer. Going through all my internships and coming out into my first and second clinical positions after school, I've seen quite a few different types of styles and management strategies to address patients and different pathologies. And I'm not here to say whether one's better than the other or one's worse than the other necessarily. The whole point of our videos and stuff like that on this website are really just to show you guys what we're doing and kind of put it out there and go, this is working for us pretty well, so maybe it's worth giving a shot or looking to know a little bit more of. I guess the same stands for everything else that I'm going to talk about here, but this is kind of my thought process of why I picked MDT over any of the other ones. So going through a lot of the places that I was working and doing my internship with, we'll start kind of at the beginning of my education there. My first internship, the clinic there was solely exercise prescription based, and it was more of a sports prescription type place, more strength and conditioning style. Old school stuff, more like longer stretches, things along that nature. And as we were going through, a very heavy base of the exercises came from the work of Dr. Stuart McGill. He's done a tremendous amount of research and found a lot of the EMG studies and different biomechanical models that demonstrate lumbar stabilization exercises that spare most of the pressure from having either a kyphotic posture or an excessive lordotic posture. So he really has led a huge front on the neutral spine stabilization stuff. So going through those, every day at work with my CI and stuff like that, we were kind of going through, and everybody was doing bird dogs, everybody was doing the McGill curl up, everybody was getting a little bit of cat camel in, things like that. And it was very mill-like, it was a very cookie cutter in a way, very, very recipe book. And that may speak more towards that clinic in particular, potentially, but as we're going through that, it didn't seem very involved. It didn't seem very patient-specific. I mean, if you have low back pain, you need some stabilization in there. So as I go through that, I kind of just was looking at it and I go, well, why do I need my 6-year degree, my 7-year degree to do this necessarily? I have all this training and things like that. And all of a sudden, everybody's kind of getting the same thing, and we're just making sure they're not worse from it. So I kind of shied away from that model because it didn't make too much sense for me. Now, in my next affiliation, it was a lot more manual-based and a lot more soft tissue-based as well. And I really enjoy manual therapy, things like that, and it seems like it does a lot of good for most people. But going into the soft tissue aspect of things, this clinic wasn't so heavily based on that, but they did do quite a bit of almost instrument-assisted soft tissue mobilization. And to that, in my head, I just kind of came up with the logic that, well, I don't really necessarily work on this a lot all day. This isn't my primary skill that I've been getting better and better. And as I looked at that, I kind of realized that there's a whole profession now that really just deals in that, and that being massage therapy. And I think the world of the folks that do that, because it's a tough gig for sure if you're not doing it with yourself in mind. You can really beat your body up doing it. But those folks that do massage therapy, day in, day out, they're practicing massage therapy. They've got to be leaps and bounds ahead of the manual skills that I've got in terms of that soft tissue mobilization or that massage type activity. So by talking to different patients, personal friends, so on and so forth, most people were saying massage helped, but then all of a sudden my symptoms kind of came back a couple days later and stuff like that. So again, not trying to start a turf war or anything like that, but if somebody who their sole job is to give massages and work that soft tissue out, if they do their job well and the patient says, in a couple of days later, I'm kind of feeling what I have been, well, I just don't understand why I should really give that a crack if I'm not super proficient in that. I mean, that's not really where my skill base is. So you can also refer to some of the other videos that we have in terms of modalities and things like that, which kind of explain why I don't practice too much with those. But in this video, I just want to kind of run down the fact that general exercise and massage therapy type aspects of physical therapy treatment just don't really make too much sense for me to do. Again, I think they're fantastic if you are very proficient at it, but for me, I would much rather refer out for a massage therapy consult or refer out for someone who needs an exercise prescription for performance or things like that, potentially, if I don't feel comfortable doing that. So the MDT system made a lot more sense for me because it's very patient centered, very patient response, guiding your treatment and things like that. So it kind of takes some of the guesswork out for me, and I kind of put my eggs in that basket so far because it's been working well for me. And kind of as I've been alluding to throughout this video, if it works well for you, then that's fantastic. Again, today's video is really not to say what's right, what's wrong, but just kind of why, reasoning of why I do it the way I do. So I hope that clears some things up for you guys. As always, please move early, move often, and move to end range because that's where the magic really happens.